Lumbar laminectomy and possible disc excision. Introduction. Can you point to the vertebrae? Choose one of the following options. Correct. Can you point to the discs? Choose one of the following options. Correct. Which one of the following two discs is herniated? Choose one of the following options. Correct. Are heart attacks and other anesthesia-related complications common during and after this surgery? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Are infections very common after spine surgery? Select yes or no. Correct. Infections are very rare. Though rare, infections, bleeding, and scarring may occur. Paralysis and weakness are very common after spine surgery. Select true or false. Correct. Paralysis and weakness are very rare in spine surgery. Although these risks are rare, they can still happen. It is impossible to injure the blood vessels and intestines in this surgery. Select true or false. Correct. It is very unlikely, but not impossible, for the blood vessels and intestines to be injured in this surgery. Can the operation weaken the spine? Select yes or no. Correct. The operation can weaken the spine. However, this rarely happens. When it happens, there is a lot of abnormal spine movement that can be very painful. A spinal fusion may then be necessary. The operation is always successful. Select true or false. Correct. The operation tends to be very successful, mainly in relieving leg pain. However, it may fail in helping the symptoms. There is also a small chance that the symptoms may become worse than before the operation. Thank you for using Explain.